This is Special Education video series, and my today video is about breast cancer screening. What is breast cancer screening? Who should be screened for the breast cancer? And what are the benefits of being screened for the breast cancer? What are the downsides to being screened by the breast cancer? What happens during a mammogram? What if my mammogram is abnormal? What about the breast exam? Can I have a breast MRI instead of mammogram? How often should I have a mammogram? So these are certain questions which need answers. What is breast cancer screening? So this is a when which doctor checks the breast for all signs of cancer and people who have no symptoms of breast cancer. The main test used to screen for the breast cancer is a special kind of X-ray called a mammogram. Now the goal of the breast cancer screening is to find cancer early before it has chance to grow, spread, or cause problems. Studies show that being screened for the breast cancer lower your chance of dying from the disease. Who should be screened for the breast cancer? Different experts have different recommendations for the breast cancer screening. Starting at the age of 40, it's important to talk to your doctor or nurse about the benefits and downsides of screening and decide with your doctor or nurse help whether to get screened or not. Some people who are at high risk of breast cancer might need to begin screening before age 40. For example, this might be the case of if you have certain genes that increase your risk of breast cancer, such as the BRCA genes. Regular screening with mammograms generally continue through the age 74 years. Some people choose to continue getting regular mammograms after this if they are healthy and expected to live for at least 10 more years. What are the benefits of being screened for the breast cancer? The main benefit of screening is that it helps doctor find the cancer early when it might be easier to treat, and this lowers the chances of dying from the breast cancer. So what are the downsides to being screened for the breast cancer? False positive. Mammograms sometimes give false positive result, and this means that the results suggest that you might have cancer when you actually do not have. This can lead to the unneeded worry and more tests, including a biopsy in some cases, which can be painful, and false positive results are more likely to happen in people younger than 50 than in older people. Finding cancer that would have not needed treatment. Sometimes mammogram find a cancer that would never have affected your health, and this can be a problem because treating these cancers does not have any benefit and can cause harm. Radiation exposure. Like X-rays, mammograms expose you to some radiation, but studies show that the number of lives saved by finding cancer earlier greater outweighs the very small risk that comes from the radiation exposure. What happens during a mammogram? During a mammogram, your breast will be X-rayed, one at a time. Each breast is typically X-rayed twice, once from the top down and once from the side to side, and this is so the radiologist can get a look at all the tissues. To make the breast tissue easier to see, a nurse or technician will flatten each breast between two panels, and this can be uncomfortable, but it lasts only a few seconds. Now your X-ray will be reviewed by a doctor or a radiologist. If they are able to do this right away, you might get the result the same day. If not, you should get your results within 30 days. What if my mammogram is abnormal? If you have a mammogram which is abnormal, try not to panic. In 9 out of 10 cases, an abnormal mammogram turns out not to be a breast cancer. You will need more tests to find out what's going on. If the doctor thinks that your abnormal result is probably not due to the cancer, they might suggest another mammogram in 6 months. And in other cases, they will do more tests. This could be because they need to get a better view of part of your breast, or because they think that abnormal result might be due to cancer. Other tests could include a more detailed mammogram, which involves taking more X-ray to get a better view, or an ultrasound of the breast to check something seen on the mammogram. An ultrasound or MRI might also be suggested if your mammogram shows very dense breast that can make a mammogram harder to read. If these tests show anything concerning, your doctor or nurse will probably order a biopsy. During the biopsy, a doctor takes a sample of breast tissue and sends it to the lab to be checked about the cancer. This is often done with a needle during a mammogram or ultrasound, but in some cases biopsies involve a small surgery. What about the breast exams? Many experts no longer believe that the breast exam by a doctor or nurse are helpful for people who have no breast symptoms. Most lumps that are found when a doctor examines the breast are not actually the cancer. Also, studies have not found that doing both a breast exam and mammogram is better than doing a mammogram alone. Some people want to do exam on their own breast. No study has shown that breast self-exam lowers the risk of dying from the breast cancer, and most experts do not encourage self-exam. Some experts encourage something called breast self-awareness, and this involves learning about your personal risk of breast cancer, what your breast looks and feels like normally, and what to do if you do notice a change in your breast. If you notice any change in your breast, talk to your doctor or nurse. Can I have a breast MRI instead of mammogram? Screening breast MRI are not for everyone compared with mammograms. Breast MRI give more false positives and sometimes lead to unneeded biopsies. Still, breast MRIs are sometimes used in people who have a high risk of breast cancer. MRI do not replace mammograms. They are used along with mammograms for people who need them. How often should I have a mammogram? It's not clear. What is the best schedule for screening is? Many experts suggest mammograms every 2 years for most people, while others suggest mammograms every year. And the schedule screening might also be different if you have a high risk of breast cancer. Talk with your doctor how often you should have a mammogram based on your risk as well as your preferences. Thanks.